All right. I think we are live. Hi, Dr. Funke. Thank you for joining us. Dr. Funke Brown is a triple board certified physician and founder of the Restful Sleep MD. I'll let you introduce yourself, Dr. Brown.
Yes, absolutely. Thank you for having me. I'm really excited to be here. Can you hear me okay?
Yes, we can hear
Okay.
you.
Yeah, so I'm a sleep physician. Own Restful Sleep MD and the Restful Sleep Place, and really our mission is to help people sleep better so they can thrive and really live a life of their dreams.
Yeah, for sure. And it looks like you just authored a book. Tell us a little bit about your book too.
Yes, so
In
yes, I'm the author
simple way.
of a book. It's called Beyond Tired, a sleep physician's guide to solving your child's sleep problems for good. And it really came from a place of hearing so many families struggle and parents, especially moms, coming in and saying, drained, I'm exhausted, I'm beyond tired, my kid's not sleeping, nobody's sleeping. And so that motivated me to, get the word out on helping people kind of put words to some of the things they were trying to express that sometimes even they could not understand. Sometimes even their doctors were struggling with in terms of where is this issue lying. So it's a great guide, I would say, for folks who have kids that are struggling with sleep.
Yeah, that's excellent. Excellent. So I am a pediatrician. So being a pediatrician, we see that a lot,
Mhm.
especially the newborn period. Parents have sleepless nights. Can you talk a little bit about what new parents can do when their newborn is not sleeping the first few days after birth?
Hang in there. I think I would actually say if you get to watch this, you're fortunate enough to watch this before you have your baby, to start to set things in place. It's never too early to start. Like, what does the bedroom environment for your baby look like? Are you going to sleep? Is the baby going to sleep in their room? Is the baby going to sleep in your room? If the baby is going to sleep in your room, how do you optimize that environment for the baby? Are they going to be in a bassinet? You want to, of course, make sure that you're not co-sleeping, because we don't recommend that. We recommend room sharing, but not bed sharing. And so you want to set those things up. You want to set up help in terms of who is going to be your team when you need to take a break, when you need to go for a walk, when you need time for your own self care. So start with that. And then when the baby comes, we do know that their sleep is dysregulated. That's just the normal thing because they have this day night reversal. And so in those times, people will tell you, oh, yeah, sleep when the baby sleeps. You don't have like narcolepsy where you just suddenly sleep as soon as the baby is sleeping. So that's probably not possible. But have moments of rest, because while the baby's schedule is sort of getting better consolidated, you will have cat naps. You will see that the baby is waking up very frequently. So focus on rest for yourself. There's strategies you can use to help your baby start to have longer stretches of sleep, making sure, again, the environment is optimized, making sure that they're fed, you're listening to their their hunger cues, and making sure they're well fed. Those are things you can start to put in place. I would say it's never too early. Even though it feels ridiculous, you can start to set up a mini bedtime routine for your baby. That may look like, okay, we're going to have a certain time where we'll have the baby we'll change their diapers and change them into, nightwear, although they don't necessarily have day or night initially. But that starts to reinforce some cues
Mhm.
that would now help your baby once they're ready to start, connecting those sleep cycles and sleeping better.
Right, absolutely, absolutely. I think getting that help is going to be super, super important because you're not going to be able to care for your baby 24/7. And, you may have other uh, things you need to do also, maybe older children, siblings you need to take care of. So, ensuring you get that help, whether from your spouse, families, always get some help and rest when you can, when you can get that help, right? Because
Mhm.
like you said, the day night reversal is really newborns. It takes how long does it take that, by the way, to normalize, and what are some of the things parents can do to help their newborn adjust to waking up more during the day and sleeping more at night, because initially they're sleeping mostly during the day and wide awake after midnight. That's what I usually see in my practice.
Yeah, no, that's a great question. So I think what you want to do, and the reason why is if you think about it, during the day when when the mother is pregnant, they're walking around, they're moving around, and those movements are very soothing for the baby, right? And that's happening during the day. And then at night, when the mom lays down, everything is quiet. The baby starts to get restless, which is at night. So they have that reversal. And it takes a few days, honestly, if you set some strategies in place. So, what are some of those things? Even though, and the reason why I would say the reason why is because they don't have full production of their brain melatonin. Melatonin is the sleep hormone that helps us to know when we should be awake, when we should be sleeping. It's not fully developed. That mechanism is not fully developed in our newborns yet. Usually, by about 3 to 4 months is when they start to have production of melatonin. But that doesn't mean you have to have day night reversal till they're 3 months. There are things you can do. You can start to do things like, during the day, let there be light. It doesn't have to be dark all the time. Take them out for walks. That will help start to, they start to get that exposure to light in their eyes. You want to start to, at night, keep things as quiet as possible. Even if you're feeding them, don't turn on the overhead lights. Feed them in a place where the light is as dim as possible. Change their diaper very quickly, so they start to learn, like, when everything is quiet and it's when it's dark, that's when people sleep on earth. And then during the day when people are walking around, we're
Yes.
awake, so I think you start to send those cues to help them, try to cluster feed and feed them as much as possible during the day so that they could go for longer stretches at night. So those are some things that you could try.
Right, absolutely, absolutely. That's kind of what I tell parents to mostly open the windows, bright light. Do not let them sleep more than 3 hours at once during the day. More play, more interaction as much as you can,
Mhm.
so that they can sleep better. The other issue is with breastfeeding. As we know, the
Yeah.
first few days you don't have a lot of breast milk. What you have is colostrum. So your baby may not be as full, but if you do frequent feeding during the day,
Mhm.
one, that helps them get whatever you have, right? So they won't be as hungry at night. That also helps stimulate your production. As we know, with breastfeeding, it's supply and demand. The more there's a demand, the more milk you produce. So
Mhm.
that's super good, Dr. Brown. Thank you so much. So that kind of covers the newborn area of sleep problems that most of my parents experience. The other challenge is, they start sleeping well, maybe around 4 months, and then they kind of regress. There's what we call sleep regression. Can you talk a little bit about that? What parents can do? When does that start? What it is?
Yeah, no, absolutely. So sleep, what people call sleep regression. I mean, I'm not a fan of it because it makes it look like your child is doing like badly, but it's a developmental stage, right? As you know,
Mm,
um,
yeah.
where they are going through a growth spurt. Their
Uh-huh.
brain is undergoing rapid changes. Their
Yeah.
bellies are getting bigger, so they're getting full. It takes, they need to feed more, and so all those changes are things that will impact their sleep. Where you may start to notice that they're having a hard time with with staying asleep, or they also start to become more aware that, okay, there are people around me that are holding me, and I really want to start to, I want them to hold me to sleep and things like that. So you start to see more wake ups, difficulties with self-soothing. But it doesn't necessarily mean like your child is regressing. I really think usually the first thing I recommend is for parents to change their mindset, see it as a stage of development, right? Your child, imagine, right, when they start to walk around, that means they start to get into things. That doesn't mean they're regressing, right? They start to explore the plugs and the most dangerous stuff. It
Yeah.
doesn't mean they're regressing. It's just a stage of life. So when you see it as that, like, okay, they're just becoming more aware of their environment. They're becoming more aware of the nurturing that you're already giving them. That mindset, I think, is the first thing, so that you don't panic and feel like, oh my God, everything I've done is not working. And this is where I see parents miss it, even in my coaching program and things like that. Is like, you just now start to throw spaghetti on the wall. You're like, okay, I'm going to now start rocking them to sleep because something is wrong, or I'm going to start feeding them more often at night because something is wrong. No, stay with your intuition, which is that this is just a stage. This is a stage of development. And so consistency, this is where, again, this also times when they start to, their brain is starting to produce melatonin. So
Mhm.
at this stage, depending on how old and how much, ensuring that the child is being well fed, and you get a clearance from your pediatrician, you start to do little bits of teaching them independent sleep. You can start to do things like putting your baby down awake but content, so that they learn to fall asleep on their own. Because one of the most common issues they have is sleep association. They're connecting that, oh, my parent holds me, and so then they hold me to fall asleep. So when they wake up at night, they are just like, wait, I need my parent to hold me.
Mhm.
So start to teach them that skill of being able to fall asleep on their own. Some people call it self-soothing. Now the thing about it is, I'm not a fan of, the next thing people start to ask is, oh, so that means you want them to cry it out. No, this is different. This is not about crying it out or not. This is about just giving them a skill where they feel confident enough to be able to fall asleep on their own. And so that's something that I would say you want to start doing.
Right. Yeah, that's a good point. So learn their routine, what they like to do, and things like that. And then I think, when can parents start, letting their newborn, putting them down while they're still awake, and not wait until they're asleep? This is one of the common problem I see almost 100% of the time. When there's sleep issue, the baby is either held, rocked, or fed before they fell asleep. And like you said, when we go through deep and partially awake state, right, that kind of starts some when they're partially awake, right?
Mhm.
So when can they start putting them down? I think parents concern is that they think they need that being held or being fed.
I vote for 4 months.
For
As
months.
long as your child doesn't have like a medical condition, and
Mm,
even if they do address that, you could talk to your pediatrician and about like what's going on. But
mm,
yeah, you could put them down to bed. You could put them down because they have started to make those associations
mhm,
between being held and needing to being held to fall asleep. So
mhm,
people will say anywhere from 4 to 6 months. But if you want to set them up for success, like you are at that stage now, this is going to save you months and months of struggle. Start
mhm,
putting them down,
mhm,
where they're awake. Some
mhm.
people will say drowsy. I don't know what it means to have a drowsy 4 month old, because they're not like, they're not like us that, oh, mommy, I'm feeling sleepy. No, you can't tell. Make sure they're fed, they're dry, they're content
Mhm, mhm.
but awake, and then
Yeah.
put them down. You could
Mhm,
shush them a little bit,
mhm,
reassure them that everything is okay,
mhm.
and then let them fall asleep. And
Yeah.
they will pause. The pause doesn't mean that they're suffering or they're in pain. Again, you've already cleared it with your pediatrician. They're otherwise healthy. They will pause. Why wouldn't they pause? I would love to be held to fall asleep if it was possible, right? So that's just their own way of protesting. Like, I
Mhm,
don't think I like this very much. This is new. This is different. So don't give up. Don't assume that,
mhm,
oh, they're struggling. And then another thing that you said, which I think is really important that many parents get into the habit of, is our babies, as they're going through sleep stages, especially the first 3 months or so, they have just two main sleep stages. It's called active sleep and quiet sleep. Active sleep is what we call REM, or rapid eye movement sleep. So that develops later. And during active sleep, they are active. They are like super active. They're fussing. They may be crying. They're moving around. They're moving their eyes. Sometimes they'll open their eyes. Sometimes they'll let out a yell or scream or cry. It's active sleep. It doesn't mean they're awake. So
mhm,
now many parents hear that for the very first time and they run to grab their baby, which
mhm,
means you just woke them up. So practice the pause. Sometimes you hear your baby making a fuss. Wait, count to 30 slowly. And you will see they might just be going from one sleep cycle to the other, so
mhm,
that you now don't start to wake them up, because those wake ups to try to rescue them because they're crying, but they're not, is
mhm.
one of the most common reasons why our babies now need to be held to
Mhm.
fall asleep.
Yeah, that makes sense. That's a good point. When it comes to sleeping on bedroom sharing or not, do you have a preference of, the baby obviously stays in the crib or bassinet um, until when it comes to room sharing,
Yeah.
when can the baby start sleeping on their own room?
Mm.
Could you talk a little bit about that?
Yeah, no, that's a great question. So the ABC, I think D of sleep. So a baby needs to be alone in their on their back in a crib or a bassinet. And D is like no drugs, no smoking. All those things can increase the risk of sudden infant death syndrome.
Mhm.
Now, the AAP, has said that room sharing is okay till first year of life. I work with tired parents. I wrote a book called Beyond Tired. I don't think your 1 year old should still stay in your bedroom if you can avoid it because you're already exhausted and they make all kinds of noises and it's just going to disrupt your sleep. So
Right.
I think this is a personal decision. It's more convenient when they're, within those first 6 months, maybe when they're nursing actively, for you to say, okay, I'm going to have them, in a crib or in their bassinet, you know, and then if they need to feed them, I'm going to wake up, just roll over, grab them, feed them, and put them back in their bassinet and continue sleeping. So for convenience, that's fine. But usually by the time babies are getting to about 4 months, they're probably outgrowing that bassinet. Instead of moving an entire crib into your bedroom, I think you're okay if you want. Again, this is a preference, regardless of what you have to think about what works best for you. It's
Mhm.
okay for you to have them in there crib in their room and have a baby monitor. So in case, of course, they're crying or things, you need to get to it.
Mhm.
Now, this doesn't sound very much like what the AAP is saying, but then I'm a sleep physician. And so
Mhm.
one of the things I want to prioritize is not just, of course, we want to prioritize your baby's sleep, but you as a parent, it is so critical. You're such an important part of this equation
Mhm.
that we want to pay attention to your mental health and your sleep as well.
Mhm.
So if you say, you know what, we love this, it is beautiful, we all want to sleep together in the same room until the baby is one, that is 100% fine as well.
Mhm. Okay, that makes sense. I think I heard you say that sleep is a productivity drug or medicine. Can you talk a little bit about that?
Yeah, no. So sleep is the ultimate tool. It's the
Okay.
ultimate performance tool. So what does that mean?
Mhm.
Many times we we want to do more. We want to be the best versions of ourselves. We want to be more productive. We want to be better in our relationships. We want to do better. If you have older kids, you want them to do better in their academics, in sports, as a professional or as an employed person or as a business owner. You want to sleep well so that you want to thrive, right? In whatever it is you're doing. Because of all the incredible benefits we get when we sleep, it is so important for you to prioritize your sleep so that you can get those benefits. Because if you don't sleep well, you don't think as well. If you
Mhm.
don't sleep well, you don't lose weight well. You have
Mhm.
issues with your metabolism. If you don't sleep well, you're more at risk for chronic conditions, which will take you out of being able to be productive. So when you see sleep as a tool to enhance your performance, it will help you kind of have that mindset to say, okay, we need to prioritize it.
Yeah, absolutely. So, what are the common things you see teenagers, young adults struggle when it comes to getting enough and restful sleep? And what are the solutions to solve some of the most common ones?
Yeah, so different things, teenagers, young adults, it's the phone, it's social media, those kind of things.
Mhm.
And it's all about setting boundaries. I mean, it's not easy. I'm saying it's all about, it is not easy. And that is why we have a whole, that's why that's why I have a job. Right?
Right.
Right? It's not. And that's where but those are some of the things you have to think about. Those are one of the common things. Because if you consume so much content before bed, you're going to get into bed and your mind is going to start racing. Now you're going to develop insomnia, and then now we're going to have to deal with all of those things. So
Mhm.
if you can find ways to kind of create those boundaries where you can separate the day from
Mhm.
the night, it really helps a whole deal. The
Mhm.
other thing is insomnia itself, which is a sleep disorder that I see frequently. A lot of people struggle with insomnia where they have a hard time falling asleep and staying asleep.
Mhm.
And the most common treatment we give for that, the number one gold standard treatment, is cognitive behavioral therapy for insomnia.
Mhm. Mhm.
And then, and then conditions like sleep apnea, restless leg syndrome, all those things. If you have any of those, whether you're snoring, you're having unrefreshing sleep, you're waking up tired, you're kind of moving around a lot at night, by then you need to make sure you see a sleep doctor, because you would need to do some testing to
Mhm.
figure out what's going on so that you can get the treatment you need.
Right. Yeah, that's a good point. Yeah, so social media and devices have become big, especially since the pandemic. And, that plus, I see even sometimes kids have TV in their rooms, right?
Mhm.
And we know the blue light does wake people up. And then you said something interesting, that the contents they are consuming can interfere with their sleep, because their brain will be processing all of that, right? And so, but as we know, sometimes hours and hours may go when people are scrolling on social media. What are some of the boundaries they can steps and boundaries they can do to limit that? And what would help when it comes to winding down, getting a better sleep instead of consuming social media or screens, like you said?
Yeah, I would say replace those, because it's sometimes it's that instant dopamine. That's what we're really looking for. So you
Mm-hmm.
want to try to replace those things with more calming activities. So
Mm-hmm.
having a bedtime routine that nourishes your mind, so your body, and I would say your spirit. So having a nice warm bath, listening to maybe some a podcast or some calming music,
Mm-hmm.
making sure that you practice gratitude. All those things give you healthy, feel good hormones
Mm-hmm.
without the dopamine jolts, which can potentially be alerting.
Right. Yes, yes, yes. That's a good point. We you mentioned the dopamine hits. It's like what causes most of us to be addicted, whether it's the sugar, or shopping, or social media scrolling is also one of them, that can cause addiction, because you get likes and things, and then or they are getting smarter. They watch what you like, and they will send you contents that you like. And so just being mindful of that, being aware of that trap. And one thing I tell people in my world and my patients is that maybe set a timer, right? Because hours can go without you knowing it. And turn off your notifications. Right. At
Brilliant.
the moment it dings, if you keep going, then it's gonna keep dinging, because they know how to get you and keep you there. It's for the social media companies, it's marketing, as we know. Maybe I shouldn't say it louder.
The truth.
Right, very good, excellent. So, what other things when it comes to insomnia? You said you give a cognitive behavioral therapy. Can you talk a little bit about that? What are the most common causes of that insomnia, and why did people need that cognitive behavioral therapy? Is it are you seeing that most people who have insomnia have some sort of mental health issues, or yeah, if you want to speak a little bit about
Yeah, so it's so cognitive behavioral therapy is really about addressing the thoughts, the behaviors that are impacting sleep.
that?
So many times people get into insomnia. Maybe it was initially like, oh, something happened, trauma, some experience, and I had a few nights of not sleeping. And now they start to develop sleep related anxiety, and they start to have thoughts about their sleep that's not helpful. And then they start to engage in habits that make their sleep worse. And so, really, what we're doing with cognitive behavioral therapy, or CBTI for insomnia, is we're teaching them about how they can break those habits using specific tools. Some of them include things like, of course, decreasing the amount of time you spend awake in bed. We also do what we call bedtime restriction or sleep restriction, where you're really giving them a sleep schedule that aligns best with their circadian rhythm. We're tracking their sleep using a sleep diary, and then we're making changes every week. So this is usually about a 6-week session.
Mm-hmm.
We're making changes to really then improve their sleep so that they can regain their sleep confidence.
Okay, that makes sense. One of the most common things I see in my practice, especially in the area we are in, high schoolers have tons of work to do and they're very busy and the environment is super competitive that they sometimes don't get enough sleep and that kind of carries on, and they most of the time feel like they're dragging in the morning. What would you say, young people, teenagers can do to help with that?
Yeah, no, I think for that, it's all about optimizing what they have. I think many times, yes, school is to blame, especially if they have to start early. But
Hmm.
also, many times there are no boundaries. So, you have a teenager who's in like 5 different sports and after school activities, and they're just running from pillar to post. And maybe they also have homework. And then on top of that, they're spending time on social media. So there are many things. So it's about crafting a schedule where you intentionally ensure that your sleep doesn't suffer. And so I think this is where, as parents, we need to come in and sort of coach them in saying, okay, you're only getting 7 hours of sleep based on this schedule. How can we optimize things? And it's not going to be perfect. They may still need to sleep in a little bit during the week, but the goal is really helping them to see for themselves how they can create boundaries to improve their sleep.
Uh-huh. Okay, got it. That's a good point. Um, there's something called sleep date. I heard you talk about that, where, when they're not getting enough sleep and they kind of accumulate that, right? So, can you talk a little bit about that? Would your recommendation be mainly to have a routine, regular ways, times of wake up and sleep and wake up, or what are some of the things parents can do? Um, because most of the teenagers do sleep in a lot over the weekend, like longer and stuff, right? So
Mhm.
is that okay, or would you rather have them have a regular wake up and sleep schedule, whether it's weekend or weekdays?
Yeah, that's a great. So with sleep debt, it's really hard to pay it off fully. And so with our teenagers, they're really short on sleep and they will sleep excessively on the weekends. I think it's sleeping in on the weekend is not a crime. I would say for our teens, I think it's when they're sleeping in till 12 noon, 1 p.m. It's not beneficial for them because it's going to make it hard for them to sleep well the following night.
Mhm.
So again, comes back to try to optimize sleep during the week, regularity as much as possible.
Mhm.
Even if you're not able to fully get like your, 8 to 10 hours of sleep during the week, you can probably get an extra hour or two during the weekend, but you don't want to go above that.
Mhm. Mhm. That makes sense. um I myself, if I don't get enough sleep the previous night, the next day would be messed up. But sometimes we may focus on productivity and we think like staying up or not getting enough sleep, we're getting productive. But just prioritizing your sleep and making sure you get enough sleep is going to be super helpful. And I like how you said consistency is important. I'll tell you a story. I used to not have consistent sleeping, and I used to accumulate some sleep debt and maybe sleep in over the weekend. But I've, for the last few years, I have prioritized my sleep and I have a regular wake up and sleep schedule even over the weekends. I am up by 5 6. So, and that is super healthier and super good, for even our young people. You don't have to sleep in when you can do a lot of things over the weekend, right? But yeah, but like you say, Dr. Brown, you, to get there, you've got to make sure you are prioritizing your sleep and getting enough sleep during the week, right?
Yeah.
So since you brought it up about the hours of sleep, how many hours are our children supposed to sleep? Obviously newborn periods longer, and then later will
Yeah.
be less, but do you have like a general ballpark of what parents can watch out for to ensure their children are getting enough sleep?
Yeah. So typically you the needs vary by age. So infants and newborns anywhere from 14 to 17 hours. Um, you know, infants about 4 months to 12, about 12 to 16 hours. Our toddlers really usually will need anywhere from 11 to 14 hours. Our preschoolers need about 10 to 13 hours. And our school age children need about 9 to 11 hours.
Hmm.
And then our teenagers 8 to 10. So
Hmm.
the ways you would be able to tell if your child is getting enough sleep or not is really just watching, observing them. They may be more irritable, they may be yawning a lot, they may actually be hyperactive and not excessively sleepy. The older ones might be sleepy, but the younger ones are trying to fight sleep, and so you'll see them become very hyperactive, very impulsive.
Hmm.
They may start to have a lot of tantrums. You may start to notice a lot of behavioral issues in school,
Hmm.
or learning difficulties and things like that. So there are many little telltale signs that can show you that the child definitely needs more sleep.
Got it. Yeah. And
Mhm.
then can you talk about quality versus quantity of sleep? How can we tell? Um, we may have gotten 8 hours of sleep, but sometimes for me too, even if I got 8 hours or 7 hours, I may not feel as rested as some of the other days when even like 7 hours, makes me feel rested. So, how can we tell those? What is quality versus quantity?
Yeah, so it's really about that feeling of being refreshed. That's the quality piece. Like, how do you feel when you wake up? Do you wake up still tired? Do you wake up unrefreshed? That might mean something is up with the quality. Or are you waking up multiple times at night? That means something is disrupting your sleep quality. And then
Mm,
the quantity is what I told you, like the actual number of hours.
mhm,
But you're right, like some people will want to focus a lot on the number of hours. But if the number of hours are right, but you're still waking up tired,
mhm,
then probably there's something going on with the quality.
mhm, mhm.
Mhm.
Yeah, what are some of the things people can do to improve the quality of their sleep?
Well, I would say basic sleep hygiene is a good way to start.
Mhm,
So you want to make sure that people are, you want to make sure that you're consistent. So we talked about that already.
mhm,
You want to make sure you have a consistent sleep time and wake up time.
mhm,
You want to make sure that you have a bedtime routine that's relaxing and gets you ready for bed. You want to avoid doing non-sleep activities in bed. So use the bed for sleep, and that's it. Other things you do out of the bed, reading, playing on the phone, all those kind of things don't should not be in the bed.
mhm,
You want to make sure your bedroom environment is optimal. So making sure it's quiet, it is calm, it is cool. Those are really important things.
mhm,
And then you also want to make sure that the phones, the devices, TV, and things at least 30 to 60 minutes are not something you're not using them.
mhm,
And then the final thing is really looking at things you need to get rid of: excessive caffeine intake, drinking alcohol, taking heavy meals before bed. All
mhm,
those things can affect your sleep. So really paying attention to those tips will help improve your sleep quality.
mhm.
But if you've done all those things and you're still tired, that might be a suggestion of a sleep disorder, especially if you're getting enough sleep, you're practicing the sleep hygiene. The
Mhm.
next step would be to get evaluated for a sleep disorder.
Yeah, very good. Excellent. Um, why is it that I'm going to ask you personal question on days when I try to exercise once or twice a week, right? On days when I exercise, I sleep really well and things. But if I missed my exercise routine, I may even if, like I said, I get the quantity, the quality is not as well. So what is the relationship between exercising and sleeping?
Yeah, so sleep actually improves with good exercise. Exercise increases deep sleep. So it helps you build a bigger sleep drive, which kind of helps you with, getting into good deep sleep, and it helps your sleep quality overall. You do want to avoid exercising too close to bedtime as
Mhm,
much as possible. So any intense vigorous exercise you want to try to avoid about maybe 2 hours or so before bed,
mhm.
because that might increase your heart rate, increase your core body temperature, and make it really hard for you to settle down and sleep.
Mm-hmm. That's a good point. So maybe if your teenager or young adult is struggling with sleep, adding an exercise activity or just looking at their activity, maybe a good idea. Yes.
Yes, 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 exactly. So I think it's important to ensure that our teenagers are active.
Mhm.
Again, not too late in the evenings, trying to get them outdoors. Usually we'll say 30 to 60 minutes, right? Every day, and that's usually sufficient.
Right, very good, excellent. All right, so like we mentioned with the social media and all of that, I think sometimes most of our children would get the recommended amount of physical activity, 30 to 60 minutes every day, but some may not. And so if you are a parent and your child may not be getting that much activity, you may want to consider that. Very good, this was super amazing as always, Dr. Brown. If people want to learn more about you, where can they find you?
Yeah, no, thank you so much for having me. I really appreciate it. I'm on social media. I'm also on my website. You can find me on my website. That's right down there.
Yeah.
The restfulsleepplace.com, Instagram and Facebook. We're at Restful Sleep MD, and those are places to start. We have a YouTube channel, Dr. Funke Brown. You could find the link to all of those, as well as the link to my book. It's on Amazon, but you can find the link and more information on the book Beyond Tired also on my website, and then you could get a copy on Amazon.
Very good. Excellent. Thank you, Dr. Brown. We'll talk to you later.
Thank you so much.
Uh-huh.
Take care.
Take
Okay.
care.
Mhm. Bye.